Thank you all for joining us. We will start in about a minute to give people a chance to log in. All right, Assalamu alaikum. Good afternoon. Thank you all for joining us this afternoon and spending your time to talk about breaking barriers, a system approach to building healthcare, education, and community equity. My name is Petra Al-Sufi. I am the Senior Outreach and Partnerships Manager at the Institute for Social Policy and Understanding. For today's topic, we will talk about system approach. System approach is one way of thinking around solving problems. We could solve problems by addressing one part at a time or one piece at a time, but putting them together or solving one big problem by solving several smaller problems, that's a system approach that will get us more results or better results for everybody who's impacted by such problem. For us at ISPU, we are a research and education institution that has been around for more than 20 years, addressing and researching problems and issues related to American Muslims. And our objective is and our vision is an America where Muslims are thriving and equal. With that vision, we look at issues within the American Muslim community and issues outside of the American Muslim community. Within the American Muslim community, we address or we research topics as related to family, youth, institutions, marriages, divorce. And our goal there is to help American Muslims build their own capacity, understand their own strength, and understand their own challenges and address them from a research perspective. For issues outside of the Muslim community that are impacting American Muslims, we look at American pluralism, we look at discrimination, we look at American Muslim contributions, and we look at the connections between American Muslims and other faith communities in this country. At the end of the day, our goal is that all decisions about American Muslims are informed by objective research. Our research touches on many topics, everything from religious-based bullying to American Muslim policy priorities, civic engagement, to views of other faith communities about American Muslims, like Latino views of American Muslims, to everything including Native American Muslim stories. So looking both broadly at this larger society that we're a part of, but also deeper within the American Muslim experience. And all of this research is available on our website at ispu.org, and it's accessible to all of you to utilize in your understanding and knowledge about American Muslims, but also in the decisions that you make in the organizations, in the places of work that might impact American Muslims one way or the other, or impact other communities who are similar to ours. So for today's conversation, I will start with a little bit of context about who are American Muslims? Who are we talking about? American Muslims are the most ethnically diverse faith community in this nation. You'll see here that we have African American, Black, Arab, Native Americans, Latinos, white, Asians, and people of all ethnic and racial backgrounds. You'll see here that there is no other faith community that is similar in its diversity to American Muslims. That is both a beautiful thing, but it's also a challenging thing when we look at challenges and issues that might impact segments of the larger American Muslim community. So for today's conversation, we are talking about the whole experience of American Muslims. It's also the youngest faith community in this nation. You'll see here again that we're comparing to American Jews, Catholics, Protestants, white evangelicals, non-affiliates, and the general public. 26% of American Muslims are between the ages of 18 and 24. That makes them, at a ripe age of not only being in school, but also starting their own families, starting to build communities, being young professionals. So every single slide here or every single data point comes with a lot of, connection to other topics in our conversation in the society. Some other data points that are relevant to today's conversation. As I said, there's a wealth of information. We're not going to be able to share all of it today. I selected few things that will connect to today's conversation to help us all understand the importance of today's topic. American Muslims also remain to being the most likely faith community to be poor. While we have a lot of wealth in the American Muslim community, we also have a third of our community lives at poverty. It's also a community that remains to experience consistent religious discrimination year after year. This is our American Muslim poll since 2016. We've seen this data around 59 to 62% of American Muslims say they've experienced religious-based discrimination in the last year. This level of discrimination shows up in interpersonal settings. It also shows up in institutional setting. This is a very important piece as we talk about addressing things systemically. You'll see some of the places where discrimination show up at a systems level, while applying for a job, while interacting with law enforcement, airport, while receiving healthcare. This is connected to today's conversation. Also on social media platforms, from the platform itself. And then, of course, almost half of American Muslim families say their kid or their students, their children who are in the public school setting have experienced religious-based bullying. Half of American Muslim families. 1 out of 4 of these cases is actually at the hand of an adult in that public school setting. That makes a system approach that much more important. And another point about public education is a majority of Muslim families do send their children to public schools. While Islamic schools are growing and there's a good number of them around the country, the majority, more than 60% of American Muslim families, still send their kids to public schools. Another thing that's related to today's conversation is also, issues within the Muslim community in how we treat or how we view each other. Remember, I mentioned that we're the most ethnically diverse faith community in this country. We also have a level of racism that exists within the American Muslim community. The good news is, I guess the good and the bad news is, Muslims are still experiencing more racism from the general public than they do from each other. But the bad news is a third of American Muslims experience racism from their own faith community. Okay, so that's a third of American Muslims experiencing racism from their own faith community, in addition to the experiences of racism and discrimination from the external community. So that's a little bit about the context for today's conversation. What do we mean about systemic approach? In April, we launched a study that looked at access to healthcare education in Southeast Michigan. But different than previous studies that we've done, we looked at this systemically. There's a whole lot that goes into this report and the study, which we will share on our. We'll drop the link here. We will share the full report after today's webinar. We've also done full conversation that you could access on our YouTube about this specific study today. But today I'm going to focus a little bit about the process. So like I mentioned, systems thinking is a way of thinking about solving and understanding the overall behavior of a system by examining different parts of it. So when we look at healthcare, for example, it's not just going to the doctor. It's not just the hospitals. There is the insurance, there's the billing, there's the transportation, there is poverty, there is the environment or the community you live in, there is what kind of experience you've had in that setting. There's a lot more that is connected to it. Those are different parts of that system. And so if you experience, or if a person experiences one thing in one part, it impacts how you view and how you interact with the other parts. And so in that study, what, the two things that came up for Muslims in Southeast Michigan, obviously it is a complex problem, just like it is for many Americans around the country. But one thing that stood out was healthcare discrimination and inequality experienced by the Muslim community, which again is something that we are seeing with other topics like education, equity within the community, and others. The way that study was done, there were participants from the different counties in Southeast Michigan, and you will see the counties here, and you will see the disparity in the average life expectancy depends on the county you live in. Again, highlighting how your environment impacts, and a lot of things in your environment impacts your overall health quality. Interviews and focus groups were done with educators, with social workers, with elected officials, with people in the hospital systems, and so people who are touching on that system throughout the process. So some of the insights, and again, I want you to think about education and equity as we're talking about this too, because some of the insight is going to be similar. Or if we're to think systemically about education, what are the different components that impact the quality of education or the quality of the experience in the education setting for Muslim students. It's everything from teacher training to how we're represented in the curriculum, to the school policies, to, halal food is provided or not, to, parent engagement, which again, all of these things, there is overlap with other communities and other students, but some of them might be specific to Muslim students too. So a lot of things that go here to, school budget, education policies, both at the local level and at the state and national level, and so on and so forth. So some of the insight here represented both hopes, but also fears. Hope that this will continue to build on some of other studies and some of other data collections from other projects. It will address the stigma. It will address, it will provide tangible outcome for people in the community to take and actually implement, but also presented with lots of fears about this might not be reaching the right people. It's just going to be more recommendations that are not going to be enacted upon, lack of change, and so on. So again, hopes and fears, which I could see them, and you could see the connection to other topics beyond healthcare. The problem statement that was developed by the workshop participants or by the community members themselves was which factors affect access to healthcare experience by Muslim communities in Southeast Michigan. So as we're talking about today's conversation, replace healthcare with education, replace that with inequality or equity within the Muslim community, replace it with your favorite topic, and think about that process as we go on. They also identified people, organizations, and institutions that will have high interest in this topic and low power, meaning they really cannot enact that much change, to people who have high power and high interest. And the idea here is you want to work very closely with people and organizations and decision makers who are both high power and high interest, meaning they have a lot of interest in what you're talking about, but they also have the authority to do something about it. You're not just complaining, you're actually talking to the right people who will enact change. And this is it falls very closely with ISPU's model of equipping change agents, meaning we go to people who could actually make change on any different topic that we're talking about. They also identified different policy recommendations, meaning if you address one policy, or here are recommendations that we have that will look at, for example, transportation. Here are all the different ideas that you could implement that will address the problem of transportation, which then will improve healthcare access. Again, what kind of policy or what kind of recommendations can we have in the education system, or when we're talking about equity within the American Muslim community, that can help us address the different parts of that problem. The other thing, and this is why we're talking about system, is when you address one part of that system, it impacts the other parts. So if you were to map out the different parts of a system related to education, related to healthcare, related to racism, related, for example, for racism, it goes everything from, you know, someone walking to a mosque that's predominantly from a community, an ethnic community that's not theirs, and they immediately feel unwelcomed because everyone already asking, what are you doing here? Where are you from? You know, are you a convert? Are you this or that? Two, is that mosque actually set up and have programs that will make that person feel they belong in that community just solely because they're Muslim? To how we interact with each other, you know, as Muslim doctors who are South Asian, for example, to patients who might be Black or Arab, but we're all in the same community, but this equity and racism things might be at play. So there are different parts of that system itself that we need to look at as well. So when we look at the different parts, we address them, they impact the rest of the loop or the rest of the system. And the big thing that came while looking at the systems loop or this feedback loop is trust in healthcare professionals. So the trust piece is the one thing that touched on the social determinant of health, that touched on racism and discrimination, and that touched on public health prevention and healthcare systems. Meaning, if you don't have the trust, doesn't matter what you put in place, it's gonna, you know, it's not gonna yield the results that you want. I have seen this with other topics as well. You know, if you don't have the trust in the school system, in the educators, in the teacher, in the principal, it doesn't matter what you put on, it does matter what you put on paper, but at the end of the day, if the trust is not there, you're not going to yield the results that you're looking for. So trust is a big thing across the board, no matter what topic we're talking about. I will keep moving here. You know, these insights or these recommendations were also verified by the policymakers themselves who are in the healthcare sector. When we interviewed them, we showed them, here's what the community members said, and they're like, yep, this is what we kind of see in our practices. Verified that, and you know, all of these recommendations, as I said, and the details are available in the report that we will share with you. So some of the recommendations, and I'm sharing the recommendations from this report, because again, if you read them and you remove healthcare system, the majority of them can still be applicable in other systems too. So recommendation number one is design and implement new ways to increase ability of American Muslims to access, afford, and trust the healthcare system. Same education, same, you know, with addressing the equity. Design and implement prevention strategies that prioritize the demographics, immigration experience, and socioeconomic makeup of the neighborhood. Address hard to reach and minoritized populations. Increase the number of Muslim community healthcare workers. Increase the number of Muslim community educators, increase the number of Muslim community, you know, religious leaders or youth leaders or community leaders who are of, you know, whatever issue we're trying to address. His holistically address social determinant of health, and then build bridges with community organizations, healthcare systems, and local governments. So those are the recommendations from this report. And conclusion, systems are the sum of their parts. When no one organization can solve complex community challenges, then a system approach is needed to bring together stakeholders from multiple parts of that system. And that's the only way that we can really make change. So with that quick introduction, I know it was a lot to cover. I want to welcome our panelists for today's conversation. And have them help us from their experience and worldview and the amazing work that they do every day, how we can, utilize or implement this approach when addressing, as I mentioned, other topics. So with us today, I will briefly introduce them, but their bios will be shared in the chat, is Dr. Joshua Salam, who's the director and chaplain at the Center for Muslim Life at Duke University. And he's the president of the Muslim Alliance in North America, MANA. He's a man with many hats. He does a lot, and he has deep roots in the American Muslim community, going back to, leading youth or Muslim youth camp at age 12, joining the U.S. Air Force, and establishing Friday prayer while he was there, and doing many, many, many other things. So this is just a very quick introduction of him. We also have Sister Bushra Amwallah, who's the founder and the CEO of the Amwallah Foundation. She's an activist, elected official, and a public speaker who have made history in 2019 as the first Gen Z Muslim woman elected to public office in the United States. She's currently served as the Skokie School District 73.5 Board of Education, where she was re-elected in 2023 and has been the leading voice on equity and inclusion in education. And then last but not least is Brother Danish Hassan, who's the director of the health department at the Islamic Center of Detroit, overseeing the ICD Community Health Clinic project, and serve as an advisory member for the Henry Ford Hospital's Zero Suicide Prevention Program. In 2023, he co-founded My Mental Wellness, the first faith-based community mental health clinic inside a U.S. mosque, and was honored with the 2025 Beacon Award for Emerging Leader in the Muslim Mental Health. Thank you all for joining us today. I'm going to start with you, Brother Danish. We just talked a little bit about the specific study on access to healthcare. You're familiar with it. Community health, mental health, public health are all topics and conversations that are very popular across the country right now, not just in the Muslim community, but they're popular because everyone is impacted. And some of them were at a crisis moment. Muslim Americans are included, as I said, because they're impacted, but also there's an additional layer where they face discrimination in that setting. And they're immigrants, there's language, there's a lot of the factors that we talked about in the study that make them disproportionately at a disadvantage in the national conversation. So can you share how the communities you have represented have approached addressing this topic using a systems approach, and how can that be replicated in other communities, especially as we don't have a lot of resources and a lot of time to kind of address some of that? And what have been the challenges in this implementation that you currently lead?
Sure. Assalamu alaikum, and good afternoon to everybody that's joining us. I just want to say it's an honor to be sharing the stage, the virtual stage with Dr. Salam and Sister Bushra, who I've worked with back in Illinois. And of course, thank you to Sister Petra, Sajil, and the whole ISB team for putting this together. So a little bit of a background, I guess, in the work that I'm doing and how it fits in with this question or the multiple part question that you asked. So Sister Petra and those who are viewing this webinar, in my first week here at the ICD, the first task that I was given was to be a part of this ISBU study that was being led by Dr. Ayaz Heather. So very much my beginning as the health director at the ICD coincided with the study that was being done here in Michigan. The Islamic Center of Detroit actually was founded in the year 2000, so we're celebrating our 25th year. And over the many years, the ICD has become a resource hub for the entire metropolitan Detroit community. One of the recent projects of the ICD has been My Mental Wellness, which is the mental health clinic here at the masjid. So My Mental Wellness itself, when we're talking about the systems approach, is unique because it started by the youth in the year 2016. And for many years, the youth, they focused primarily on programming because the stigma in our community for mental health is no surprise to anybody. And what's unique about the Dearborn, Detroit community is that it's so diverse. We're talking a community that had immigrants as early as the 1920s from countries like Yemen and Lebanon who came to work in the Henry Ford factories, to modern day where you're still having immigrants and refugees and newcomers coming to Dearborn in Detroit from countries across the Middle East, and even now places like Afghanistan. So in terms of the Muslim community here, it's very, very diverse. You have recent immigrants and you also have third and fourth generation families. Um, so when it came to mental health, not only were we figuring out what the best approach is in terms of the access to healthcare, but also how do we break the stigma and make it available and accessible to the vast community that we serve. And the youth committee back in 2016, they realized that we have to slowly introduce the conversation here because the community has to trust us, and trust is a word that Sister Petra, heard you use multiple times. But it really is the foundation by which a lot of our services are built upon. So for the first couple of years, we had many different events under the umbrella of mental health. So whether it was parenting, whether it was bullying, we had an event with the FBI on domestic violence and human trafficking. We work with the Family and Youth Institute locally for programmings on pre-marriage counseling, and special needs was a big part of the work that was being done for that community. And slowly, we started introducing the idea of mental health to the community. And one thing that I think has been a success of this project was that from the very beginning, because the Islamic Center was at the forefront of this, there was a natural element of faith-based practices that were implemented, whether it was our food pantry that distributed 20 million meals during the COVID pandemic, or whether it was our social services, which includes, even to this day, we provide assistance with rent, with utilities, with immigration. Our ESL classes are free. We just finished a federal grant that oversaw vocational training. So anyone that was new to the United States in the last 5 years, we taught them plumbing and electrical work and carpentry. So we've created this whole ecosystem here. So when we're talking about systems, I mean, we literally built a community center that is helping individuals with all aspects of their life, whether it's education, whether it's economic struggles, or in mental health or health. And alhamdulillah, by the grace of Allah subhanahu wa ta'ala, in February of 2024, we were able to establish and open the first mental health clinic inside any Islamic center in America that's fully operational. So our staff includes 4 licensed therapists, 2 student interns. We have 2 of our therapists working in programming that are not clinical. Plus, we have a full-time office manager. We have a health program coordinator. And all of this is now under the umbrella of the ICD Health Department. So again, thinking about, where we are in the community and a lot of the barriers that exist, ICD decided that we had to do a little bit more in terms of providing access to healthcare for our community. So in 2013, there was an abandoned elementary school about 3 miles from the Islamic Center here that had been abandoned since 2008. So ICD actually purchased that school from the city of Detroit, and we're building that into a community health center, inshallah. So along with our mental health clinic, which as even until right now completely operates free of cost. So all of our sessions are pro bono, and this year alone we've alhamdulillah completed 1,000 sessions for the community, along with all of our programming in the health department. We're trying to break the stigma. We're trying to provide direct services to our community. And again, with that systems-based approach, we're trying to figure out what are the other barriers. So if it's transportation, can we work with the city of Detroit to have busing to different local organizations that might be able to provide some more support? If it's the issue of trust, can we bring faith into our practices? If it's something larger of a systemic issue, Can we build multi-sector partnerships, which is something that ICD has heavily invested into? So members of our board and our staff are actually part of the Detroit Public School Faith-Based Council. We have relationships with universities and hospitals, the school board, and we're identifying Muslim leaders and other leaders who are culturally sensitive to our community in various sectors to strengthen our partnerships, because we alone cannot do everything. And the other thing that I think is very relevant to the conversation is about community leadership and that talent pipeline. How do we get the new generation of Muslims to be community focused, to see the bigger picture and be a part of the change that we want to see in our community? And I know I'm short on time, but some of the challenges, obviously, when you're doing something from within the Islamic Center, there's a lot more criticism, not only about the service, but also about the way that faith is being implemented. And when you're working on with such a diverse community, there's a lot of opinions when it comes to how faith should be implemented into not just the health sector, but into any community service. Scaling and funding, right? Not every community is able to bear not every masjid, I should say, is able to bear such a burden. Alhamdulillah, we've been in a situation where there's been a lot of support from the city and the county, and over the past 25 years, there's been a lot of collaboration from other entities that has provided some sort of relief. So the entire burden on funding isn't on the ICD. And then, of course, specifically with mental health, the stigma has been one of the biggest issues. But again, from my office, I'm about 40 feet away from the men's musalla, about 60 or 70 feet away from the women's musalla. We have over 5,000 individuals walking through the doors of the ICD every day that see the mental health clinic in full operation. So one thing that we've done to break the stigma is just to open our doors up inside the masjid, and that itself has been fruitful. And one thing that is a testament to that is this year alone, since January till September 1st, we've had over 110 new clients enroll in our mental health services here.
Thank you so much, Brother Dennis. This is amazing, and it's a journey that I'm local, so I've kind of seen it grow from a small workshop run by students to, mashallah, the purchase, and now the expansion, and also just the conversation about that nationally, about how can that be replicated. But like you said, there are a lot of challenges in different communities around resources, relationships, and just capacity, which I think that's something that a lot of other people in a lot of other communities are struggling with. And I think the more we continue to chip away at this, the better or the faster we'll get some results for our communities. So I'm going to switch it over to Sister Bushra. Bushra, keeping the same mentality, same, how can we do this holistically and systemically? I want to shift over a little bit to education, which, Brother Danish mentioned students a lot. Students and young people are very, very active, and they're part of the solution-seeking generation, not just talking about problems. So within the Muslim community, as I mentioned, majority of Muslim families send their students to public education. From my experience doing this work for more than 15 years, one of the things that we've seen is the lack of representation, or actually the negative representation of Muslims in Islam in the school curriculum, in the public education curriculum. Not only that, but also the discrimination that students themselves face. So Muslim students are included in that struggle with with the additional piece of their religious identity being a target. And even right now, the political climate make them that much more of a target. And then when you are in a school or in a education setting that's trying to do its best, you still come across, lack of cultural experience, background information, and then even external opposition to some of the policies that will make students feel welcome and included. So all of that background, how can you, from your own experience as someone who have done this, how can we approach this issue systemically? and ask or try to seek reform or change in the education setting that will not only benefit Muslim students themselves, but we know will actually open the door and benefit some other minority groups as well. How can Muslim families, especially in communities who are stretched very thin, either lead this initiative or being a major player in it, no matter what their interest is?
Thank you for posing the question, and it's always fascinating to be able to join after a presentation that has so many tidbits and pieces of information that even I, as a panelist today, can walk away from. So thank you, Sister Petra and the ISPU, and it's great to see Brother Danish and again, Dr. Salam, to be joining alongside such incredible experts and leaders in the community today. Context about me, my name is Bushra Amiwala. It's great to be here today. I became one of the first people in my generation to hold elected and public office in the country. And I start with that because generations share the most common attributes than any other demographic subset. So you put together a group of women, a group of people from the same religious or faith background, and a group of people from the same generation. And the group of the people from the same generation will have far more in common than any of these other groups. And I lead with that because generationally, we have seen there be more of this approach to inclusivity being ingrained in the fabric of the way that we engage and interact with other people. We also see coalition building being a natural element and tadpole of how we embrace leadership universally and across the board. But the reason I acknowledge generations first is because that isn't always the case of how it's been. There's been this unfortunate subconscious ideology that essentially promotes infighting amongst different minority groups across this country, and that's intentional and it's predatory. So a little bit about me and my background. I got elected to a Board of Education seat in 2019, and I was a 19, 20-year-old student running for this, and these was to represent the public schools I attended growing up. And it was very easy for me to almost inadvertently brand myself as the Muslim candidate. And there were Muslim families that shared the importance of having halal food accessible to their students. And even for me as a former student, I mean, lunchtime is like the best time of the day, and it really can set the tone for the rest of the school day afterwards too. But similarly, we also had Jewish families that were advocating for kosher options for their students. Similarly, we have actually 66 languages spoken in my schools, and I know that Sikh families cannot eat halal meat. Hindu families want vegetarian food options. So as a visibly Muslim person, I could have started and stopped at the Muslim imperative issue of offering halal food. But to be actual faith-based and Muslim leaders rooted in justice, we know that this does not start and stop at our issues, but we have the responsibility to coalition build with other groups. So my school became the first public school in the state of Illinois to mandate the offering of halal, kosher, and vegetarian food options for all of our students. And that is something that was unheard of at the time back in 2019. And alhamdulillah, since then, with partnership of groups like the Illinois Muslim Civic Coalition, they were able to write this piece of legislation in partnership with my state senator. And I was invited to testify in front of the Illinois General Assembly to showcase this act, to show that this not only works, but it's also the viable way to serve the people that the state of Illinois represents. So now every public institution in the state of Illinois, that includes schools, prisons, hospitals, have to require that they have offerings of halal, kosher, and vegetarian options for the people that they serve. I come back to, the responsibility that we have as American Muslims in this country when we are working against the system of the media. The media has been working in a way to otherize our community for as long as it's existed as an institution. So every single thing a Muslim American does under the realm of leadership is not only one viewed with a microscope, and it's being dissected by people around the country with a very racist and Islamophobic lens. But then I've also found that people within our own community have these incredibly high standards and leaders and expectations for our leaders ourselves, to the point at which we're almost being held back from progress in that way. And this is why educating communities on the contributions that Muslim Americans have had in the fabric of mainstream society is something that I'm also incredibly passionate about as well. So again, I have to acknowledge the Muslim Civic Coalition again, because you always should give credit where it's due to these organizations, leaders, and institutions. And I've had the pleasure and privilege of serving on the Next Gen board for about 7 years now in this capacity. And similarly, we wanted to educate public schools on what American Muslims have done in the mainstream of history and the contributions we've had. I mean, we know that we invented algebra, we invented coffee, but even beyond the extension of that, from advancements to science and technology and architecture and literature, there is so much that goes into this space. And something that always grounds me is the facts. So although Muslims make up of almost 25% of our global population, we are really truly 1.1% of the US population. And when I keep that in mind as a Muslim leader that is leading in education or climate or economic business and expansion, I do know that that is an inadvertent hat that I'm always wearing as well. And so coming back to the education in the classroom, we look at the people that have written the textbooks that are being used to educate our students. I mean, McGraw-Hill as an example. And then we question why so many of us, myself included, have gone so long in our lives in society without knowing perhaps the truth in certain elements. And we look at the access to the media and the literature that we have. So as Muslim families, something that every single person watching this webinar today can commit to is supporting our Muslim authors, purchasing 5 books and donating them to your public library, not just as an institution, but your public schools in your neighborhood. Because if we are not going out to purchase these books ourselves, supporting Muslim authors that are taking shape of the Muslim narrative, who else will? And that really is what I see as low-hanging fruit. Something that I really like to champion within the realm of leadership is what I call everyday leadership. We've made leadership so greater and beyond ourselves that, yes, it can look like passing statewide legislation, which alhamdulillah, states like Illinois have been able to do. But what about the pieces of everyday impact and leadership that all of us can walk away from doing starting today as well? And then finally, it's really as the media and other institutions try to otherize what Muslims care about, it's acknowledging that Muslim values are not different from American values. We all want access to healthcare, good schools, safe neighborhoods, and the responsibility is on us to be the counter example every single day as to what we actually truly care about and coalition building around that. So my biggest takeaway to all of us is that just all of us even being in this space is the shining counter example towards the hate and the bigotry that exists beyond our own communities. And I really actually acknowledge that statistic that came up that 1/3 of American Muslims face that honestly inner racism within our own community. And that is something that I think is our biggest downfall. And I'm doing this to turn the lights on. As a group, and I'm excited that groups like ISP are acknowledging that, calling that out, and actively organizing against it. And thank you all for the time today.
Thank you so much, Bushra. This piece of, the conversation, it took our community a while to come to term and publicly start addressing, similar to what we did with post 9/11, where, it took us about 10, 15 years before we started talking about poverty within the Muslim community, because we were busy presenting a model community, a community that's only successful, and then realized there's a lot more to our community that needs to be talked about in order for us to really be who we are and address our challenges. So I feel we're doing the same thing with the racism and the equity piece, where it has been there. It's not new. It's been there since day one. We've had a lot of models to in smaller conversations, sometimes bigger conversations to try to address it. But I'm seeing a shift over the last few years where now it's the big elephant in the room that's people are talking about, and sometimes they're not. So I did want to bring it to the main conversation. And I couldn't think of a better person to help us, bring this to our audience than Dr. Joshua Salaam. I'm gonna throw the very easy question at you. And I am aware of what I'm doing. So, I'm grateful for your patience here and your participation. can we really move forward and address all of these other challenges that we just talked about and the many other ones, and be civically engaged and do all of these things that normal and other communities are doing every day? Can we do them successfully? Can we advocate systemically successfully without really addressing and talking about equity within the Muslim community, specifically addressing racism within the Muslim community? And the good thing is we're not talking about the majority of Muslims being racist, but it is there and it's impacting us. Can we do that? And then what are some of the best and bravest approaches to addressing that challenge? So thank you for joining us.
Thank you. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. I begin by seeking protection with Allah from shaitan. I begin by speaking the name of Allah, whose mercy is infinite. Allah's mercy is continuous. I've already started my 6-minute timer, of which I have 6 minutes and 45 seconds left. So I wanted to start with a reframing of the origin story of shaitan, because most people, when they read the story of shaitan, I think the main thing they pull from it, or at least what I've heard, is that it's a story of arrogance. Shaitan thinking that he is better than Adam or this other creation. He's made out of fire, Adam's made out of dirt. And I think there's another piece of the story that we can reflect on, because after Allah told him, get out, you've disobeyed me. Who said that you're better? Based on what? Get out. Another aspect of shaitan comes up, which says, well, hold on. If you give me some time, I'm going to prove to you that this is an ungrateful servant. So my reflection on that is that another aspect of that story is that this desire to be right, in addition to the arrogance, there is a human desire to be right. I just enjoy it. I want to win the argument. I gotta, what I'm doing is right. What you're doing is wrong. What I'm doing is intelligent. What you're doing is stupid. And making sure that people know that. I think that's a human design that we have to struggle to get past. And it's possible, just like it's possible for me to lift a lot of weights, but maybe not right now. But if you said that you wanted me to lift those weights, I would get a personal trainer and I would start exercising and building up my muscle so that I can do it. We have to realize that the work that we're talking about here is a heavy lift. It is not easy. It is not just about, I believe in Allah and his messenger, and therefore I can get along with anybody in the community. No, it takes work. It takes spending time around other people and getting to know them. So this is work that we have to do. So the next thing that I want to do is talk about, in my last 4 minutes and 45 seconds. Wow, look at how that time goes by so fast. DEI needs to be reframed. I personally call it EID, which is Eid, which is something that should be celebrated. Our differences should be celebrated. So when you hear people talking about in the media, oh, they let this new football coach in because he's a DEI pick, right? In their mind, what they're saying is that he's not as good as the other coaches, and that's the only reason why they selected him. When in fact, the concept behind this DEI is there's been all white coaches. All these football coaches are white, and it's been like that for 70 years. There's a black coach over here who's just as good, if not better than you guys. He needs to get a chance to be in this pool of coaches. It's not about we're bringing him on because he's black. Is making sure that if we're going to hire a coach because of his coaching ability, then this person needs to be in the picture. And so just reframing people's mindset of what DEI is. It's not about, oh, we're lowering the bar. No, we are determining what the bar is, and people are getting access to these resources, despite if they're a man or a woman, despite if they're black or white, despite these things. So I think that's a very important reframe that we all need to think. And I'll give you a tangible example for our community. How many times have you seen a flyer that has 5 or more speakers on it, and they're all male? They're all male. Now, what we have to do is ask ourselves, do you mean there's no female speakers that know just as much as those brothers? that have just as much accolades, graduated from famous Islamic universities, or just are respected by the community. It's always, and sometimes I've seen the list go up to 10, 15 speakers that are all male, right? So I knew one community in Houston that reframed it. They did a conference and they made all the speakers female, right? It was an all female lineup. And the assumption by the community when they saw the flyer was, oh, this is an event for women. So they weren't even interested. And so we have to think about that. Okay, well, why is that? When you see something that's all male, it's for everybody. If it's for all women, it's just for women. So yes, we have a lot of work to do on internally, as far as how we look at each other and how we're looking at the Muslim communities. And my last 2 minutes, I'll just say that my chaplaincy has really helped me struggle through this thing that I'm talking about. One of the things that I do is I try not to make my language seem better than whatever you have, right? In politics, we just had a sister who was elected official. Sometimes people in politics will feel the need to cut down the other candidate instead of just saying what they do well. I do this well. I have, helped this homeless organization. I have, went out on the streets and helped people. Say what you do well and get out of the culture of cutting the other person down. We have to do that as the Muslim community. Speak with beautiful language. Lift up what you do. We don't have to make other people look bad or speak in a way that makes the other feel bad. I'll end with this in the last minute that I have. Sister Petra talked about the American Muslim community being one of the most diverse or the most diverse community in America, maybe in the world. Is that a strength or is that hurting us? I think if we lean into the verse that Allah says, I've created you so that you can get to know one another, so that you can learn from one another, that our community is uniquely positioned to do that the best. We should be the strongest community in America because of our diversity, because there's nobody else that is as diverse as us, that has Latinos and Chinese and Uzbekistan and people from Cincinnati, people from Pakistan and India, and all over the world. We have that in the Muslim community. But are we learning from the different cultures, or are we just bad-mouthing one another? And this culture does that, and this culture does this. So I really pray that we can lean into the skill and away from the satanic type of mindset that we have to be right and there's some sort of arrogance. And we lean into the beautiful verse that Allah has made us different. He's made us with different opinions and outlooks and vision so that we can learn from one another. And inshallah, we will be stronger together. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much for that. I know that was a challenging question to throw in 7 minutes, but I believe you provided concrete examples of how we can do what we do best, talk about each other in the best way, not undermine each other. And I think these approaches and also, have the similar reaction to if you see an all-male panel, I, as a woman, will have a uncomfortable reaction, and I will ask the same questions that you asked. But also, if you see an all Arab or an all South Asian or an all, white panel talk about Muslim issues, unless it is for that specific group, then we should have that same reaction and ask who is speaking on behalf of the most diverse faith community in the country. And that goes for, whether it's local conversations, mosque conversations, to national stages. And I think that's a call for all of us to kind of pay attention to, beyond just the public speaking, but it goes deeper into who's delivering the khutbah, who's doing the youth programming, who's representing us on national TV when somebody needs to speak on behalf of American Muslims. I believe media representation came up. We just released a study that looked at representation of American Muslims in popular media and its connection to anti-Muslim policies and anti-democratic policies. And I put in the chat our fall programming, which that's one of the topics we'll be talking about. And also, American Muslim Poll is coming out as well. For the sake of time, I'm gonna ask a question for the panelists. There's a couple things that came up. I think both Danish and Brother Joshua mentioned them, which is kind of the reaction that, people who are trying to do work in the Muslim community, the reaction they receive from the community itself. How, and of course, I know, Bushra, you've faced it and you've experienced it as well. How can we, on one hand, address that in the best prophetic manner, where we're not destroying each other as people? Two, how can we as leaders and as people doing the work continue to do the work and still be seen as authentic leaders of the communities that sometimes might be, questioning our leadership. And I think it's relevant here in terms of representation. If we are in a place of representation, whether it's at the policy making level, community leaders level, or at an interfaith level, not everybody is going to be at that table. How can the people who are making it to that room still do the good work they need to do on behalf of the community, while at the same time taking the community's concerns into account? And anyone who feels strongly about this can jump in.
Oh, I feel strongly, but I'll go second.
I'll go ahead and answer, but then I'm going to bring Dr. Saddam into the conversation pretty quickly. I think this is the diversity challenge is definitely an issue in our community, especially because we flock to individuals that look like us. And, without mentioning any specific ethnicity, but, our social gatherings or our work in the community is usually with people that look just like us. And this is something that we've noticed very much in the Detroit community, because, again, there's so much diversity that it's very difficult to bring 3 people together, let alone thousands of households. But I do think there's 2 things that we've done well, or that we've found a way around, I guess, reframing the way that our community thinks. One thing that our imam does really well here, and I'm sure others do this too, but I'll speak on his behalf. He's constantly reminding the community of what a masjid should look like from the Madani concept of a masjid that the Prophet ﷺ established. Right, the masjid or the Islamic center should be a place that's welcoming the poor, welcoming the orphan, welcoming the new immigrant, welcoming the homeless, welcoming the one that's struggling with mental health, welcoming the ill, welcoming the widow, welcoming the single mother, right? So constantly explaining this to our community that, this is more than just a place where you walk in, you make your salah, and that you leave, right? There will be people here that don't look like you. There will be people here that don't practice like you. There will be people here that don't agree with you on even some of the things that are part of our faith, right? So disagreement is natural, but reminding everybody that what the role of our institution is. Number 2, I think a lot of our community leaders and institutions, and again, not to paint everybody with a brush, but many of them, I think the work is where we were 20 years ago, and many times is still kind of what we're doing, right? This copy and paste, like, our health fairs, like, for example, right? Or our open houses for the community. They've been the same for many, many years, right? But how are we really reinvesting in our community? And are we taking it a step further with our collaborations and with our elected officials, with our community partners, right? How can we really grow in that sector? I think once you naturally start growing and start digging a little bit deeper, the community will follow.
Okay, my turn. And then when you get to the first question in the Q&A, I can address that too. But on this one, the reason why I feel so strongly about this is because as a Black American Muslim, I'm fairly aware of the ongoing strategic effort to infiltrate our community to break it down. This is historical fact. I don't know any American that doesn't believe that this happened, where the government and sometimes other parties are putting people that look like you and talk like you and into your fold for the purpose of making sure that you don't succeed. I still believe that happens. Maybe other people don't. I still believe that happens to the Black community. I still believe it happens to the Muslim community. And there's a couple of cases that I can tell you, I don't have time right now, in recent history of infiltration of the Muslim community to provoke the Muslim community or to just ensure that we don't succeed. Therefore, this topic is very important to me, because if we don't figure this out, how to come together to hold each other accountable, to find the balance between spiritual bypassing on one side and cancel culture on the other side, and find some space in the middle where we got to have a conversation and talk about, why did you say this? It really hurt our feelings. Why did you do this? It feels like you're moving without the Muslim community. Like, we got to talk, and we got to figure out how to do it publicly and hold leaders accountable. Because if you don't, it allows an experienced informant to just come in and spread rumors, and people believe stuff without verifying, and then all of a sudden your community is just apart. So for me, this topic is very important. I hope the community can practice it, learn it, finding the balance between just saying somebody, oh, we wish the best of people, I'm sure they didn't mean it, that's on one side, and just astaghfirullah, why did they do this? We're never going to work with them. Don't invite them to nothing again. Right? There's a space in between that we have to get better at as a Muslim community, to weed out those who either have just in their heart they don't want to work with people, or to weed out people who have been put there to make sure that we don't succeed.
Thank you. That's really important. Bushra, I don't know if you have anything you want to add, or I could go to the questions. Okay. So we have a couple questions in the chat. One is internally, so looking at the Muslim community internally, and one externally, and they're both related to, Muslim women. So internally, how can we convince, or how can we get, masajid and mosque boards to see that, a small group of local women who are active in doing the work, that women, youth, and American-born Muslims need to be included in decision-making in order to be more inclusive. So how can we do that? How can it be sustainable? And how can we bring the whole segment of the Muslim community kind of together? And then same theme, but looking at externally, how can we elevate the voice of those Muslim leaders, Muslim women specifically, who are doing the work at the local level and in our own communities? How can we elevate their voice and open doors for them in spaces where their voice and the Muslim community's voice as a whole is missing, whether it's a school board, city council, others. So how can we get the community to rally behind them? And I'll share some resources after. I think, Brother Joshua, you said you wanted to address the first part of it.
Yeah, but it specifically said Muslim women, so I think we should give Bushra the microphone first.
Sure. Thank you. I appreciate that, and happy to briefly touch on both of these and group them together as well. So starting with the internal politics that exist within masjid dynamics and in places of worship, particularly within the Muslim community. I remember in 2017, when I first ran for public office, I wanted permission to have a table outside Jummah to collect petition signatures to get my name on the ballot. And this is something that other places of worship allowed. Most masjids are 501c3, so that fear of infringement upon nonprofit status was a very common misconception that people had. But I attended 6 back-to-back monthly board meetings. And I've learned that being a Muslim woman, there are cultural and faith-based expectations. So I was happy to abide by those, meaning I would go, I would speak a bit softer, I would listen more than responding, because of that perspective of respect will get me the ask that I am advocating for, then in my eyes, that's cultural competency. And that's a short-term struggle I'm willing to compromise on for the long-term gain that I'm advocating for. And even Dr. Salam touched on this piece of arrogance, and I don't think it comes from a place of arrogance, but it's an acknowledgement of that internal discourse back and forth. So I'm happy to meet within the confines. I also will make sure that my hair that shows in my hijab, that it's fully covered. And these are things that I'm able and willing to do because I'm recognizing the institution and the leaders of the institution that are upholding those values. So I would say meet people where they're at, and they will meet you where you're at after too. The second piece, which does tie into this first, so from the external component, I have found that the Muslim community in general is, I don't want to say a bandwagon community, but we love to support something that's already popular. We have the power to make something that is on the come up popular itself, but we do not do that. And when there is whether it be Muslim woman that you're hoping to champion on a board or externally in some way, then we need to be the organization and the people that prop that person up, as opposed to being like, oh yes, sister or brother, go do your thing. And then when you win, we'll be championing, saying, I went to school with her, I went to masjid with her, she's my sister and I know her. And that is something that I feel like our community has failed many of us that have been the first in spaces, because there isn't a playbook for us to follow. So that's what I would close with. And Dr. Sam, I appreciate you passing it over here and would love to hear your thoughts on this one too.
Just very quickly, for the sake of time, I would say put it into 2 tracks. On one track, pick your best spokesperson, like the story of the companions that the Prophet sent to the Christian king, right? And they had to advocate for themselves when the Meccans came to like grab them back. They sent their best spokesperson out, and he killed it. You know, he did a wonderful job and won over this Christian king. You have to send your best female spokesperson to be a constant advocate and work with the board and get them to see and have dinner with them and go over to the house. And that might take a year, might take 2 years to really get into people's hearts, but take your best. Not everybody's good at that stuff. Okay. Then on the other track, just do the work. Just make the program, see who comes to it. The market will adjust. If people like it, they're going to come out to it. Then the board will see like, oh, there's people interested in that. Or you might find out that nobody's interested in it. And maybe it was just your 5 friends that wanted it, and you realize this is the wrong community for us. You know, we need to go to a different community. So sometimes something will reveal itself when you just start doing the programming. You either get better at it, or you might realize that there's a disconnect somewhere. So that's what I would suggest.
Thank you both for that. And we will share resources with everyone post-webinar. So ISPU actually looked at this topic many years ago while studying mosques and reimagining Muslim spaces, you know, trying to make them or provide recommendations to help make them more accessible to women, youth, converts, and African-American Muslims. And the way we approached that was actually looking at best practices. So we looked at communities that are already doing that well, and grabbed recommendations from those case studies that were published and now everyone could use. So we will share that resource with everyone, and it's a very clear case because there's all the research is very clear on the connection between mosques that are accessible and people attending mosque and being welcomed at mosque, and they're just civic engagement, contributing, volunteering, doing all of that. So, and identity, and it's well documented. I'm gonna ask one last question and then we're gonna close here, but I don't want us to only focus on what the Muslim community can do, because they're doing a lot, but there's also the other part, which is sometimes we're not at those decision-making tables. So for the sake of systemic conversation, we already addressed the responsibility of American Muslim leaders, looking internally, what can we do on different topics? But externally, how can Muslims ensure that we do end up having seats at the table, or our voices, if we're not at the decision-making table, our concerns and our voices are represented in the decision-making space? What is the role of our allies and those who are holding office, because they are responsible at the end of the day for everyone, not just for a certain group of people. So how can we get our rights in what we need, even when we're not present? And I will let whoever want to take that one.
I'm happy to start with this one again, if that's okay. So I'll speak about this from a legislative lens. And when we talk about our allies, I think we must first look internally as a community to recognize who are we allies for first and foremost before we make demands and expectations of other allies. So are we showing up for the Black community when there's injustice? I mean, even today there was a tragic murder and lynching that happened. As Muslims, are we uproaring against this hate crime that happened? Similarly, we see ICERETs that predominantly are targeting our Latino brothers and sisters? Are we showing up for the Latino community? And then in turn, the ask becomes, we see something as example of the Block the Bombs Act that was written, which I'll just leave it at that as a neutral phrase, but we had a Latina representative, Representative Dalia Ramirez, that wrote and co-sponsored that act for us. So now we have our allies that are not Muslim championing what could be deemed as Muslim issues to, again, normalize and bring it back into the conversation of mainstream American society. So we are not the only ones advocating for ourselves, because that inadvertently continues to otherize us whether we realize it or not.
Danish, please take the final word, sir.
No, I mean, what Bushra said, it makes a lot of sense. There's two other things that I would like to add, especially because we're in a nonprofit setting here at the IACD. One thing that we've been recently focusing a lot on, well, two things. One is understanding what the need is of the community, right? Because we can't advocate for the need if we don't understand the need. And I think this is one of those challenges where sometimes our board members or other individuals who have some authority or decision-making power are sometimes so disconnected from the rest of the community that what they're like who they're aligning with or what they're prioritizing doesn't really serve majority of that community. So number one, I think, is identifying the need. Number two, I did this work in Illinois with Bushra and the Muslim Civic Coalition, but there was a huge focus on data collection. And actually the Michigan Muslims report with ISP came out while I was there. And I think that's one thing that we're sometimes missing in our community, where, the world is changing towards a data-driven approach. And whether it's our masajid or our Islamic institutions, I don't think that we're keeping up with that. Even on our level here at the ICD, we have about 350 to 400 families weekly that come to our food pantry, but our data collection on that is not as strong as it could be. For almost 3 years, we were operating mental health services at the Islamic Center Detroit, but we were using paper notes instead of electronic health records. So when it came time for data collection, I mean, who's going to sit here through hundreds of patient files to count how many males we saw, what the ages were, what their ethnicity? It's just not realistic, right? So I think if as a community we focus a little bit more on data-driven approaches, and not be so scared of the tools that are at our disposal, we'll have a stronger case when we advocate to our legislators and to our friends in different sectors.
Dr. Sam, anything on your end?
No, actually, I'm thinking about the equity. See, when you first asked the question, it was Danish and myself, and Bushra didn't say anything. And then Bushra and I spoke, and Danish didn't say anything. So I said, they need to speak, and I need to not say anything. But thank you for asking.
I appreciate that. And I thank you all for, the wisdom, the expertise that you shared today. I want to thank our audience for joining us. And we are sharing a lot of resources in the chat, and I just shared the upcoming fall programming. Obviously, there's a lot more to this conversation than what we were able to cover today, but I hope it opened doors and gave people an idea for, to start somewhere. And I am sure we will continue this conversation in many other settings. So thank you all. Thank you for your time. There's a, survey that we launched because we do data collect a lot. Share your opinion with us and email us if you have any other questions. Thank you to our panelists. And have a good afternoon.